Just give me 1 second, just making sure everything's all good. Okay, Cary, whenever you are ready, you are good to go in 3, 2, 1.
Good morning. This is Darrah with Grow Cedar Valley, and I'd like to welcome you to the beginning of our series of Facebook Live sessions, so we can bring you updated information throughout the next several months. Today I'm welcoming our 3 guests representing the healthcare industry. We have Pam Delagardelle, CEO of UnityPoint Health, Allen Hospital. Also have Dr. Kimberly Neumann, Co-Medical Director of People's Community Health Clinic. And then we also have Dr. Matt Sojka he's Vice President of Medical Affairs for MercyOne. So I welcome all 3 of you. And we talked a little bit before we got started this morning, and I've heard each of you at different times, and your information is so relevant, but I also know it's changing all the time. And so we know that people hear things at different times and that it resonates with them depending on what's going on in their life. So even if you think you've shared this information before, it may not be to the folks who are tuning in right now. So I'd like you to please start with an update about where you are with your industry, with your organization, about what you want the folks that have tuned in to understand. And then also what we need to know as a community that we can do to either help you or be better stewards of what's going on. And make sure that we're all pointed in the same direction. So I think I'll start with you, Kim, if you don't mind. I heard Kim a few weeks ago speaking at the county briefing, and she's a pediatrician with People's Health. Is that correct?
That's right.
Okay, I'll go ahead and let you take it over, Kim, if you would, please.
Okay. So, I'll recap a little bit of what I had talked about when I spoke at the EOC. I think that was last week. It is really hard for families because we are kind of stuck at home, a lot less interaction socially than we might be used to, and really a lot more interaction maybe with the people within our home than we might be, a little more togetherness than we're maybe used to.
Right.
And so we've just gotten through the Easter holiday. Which for many people typically is a gathering point, and we strongly encourage people not to do that. And I know that's hard. I really have been working with the families that I've talked with to see this as an opportunity to try different things with your family and to really have some togetherness rather than just seeing the negative sides of the social distancing. So, to be at home with your family 24/7, if you happen to not be working, is really an opportunity to try some things that maybe you don't always take the time to do. Play board games with your kids, get your kids involved in, meal preparation, teach them how to cook, teach them how to knit, teach them the skills that you learned when you were a kid and you were maybe less socially connected and media connected than you are now. So I think it's really important for children because they're going to take their cues from their parents. And so try and portray things as best you can in a positive light to them. No, we can't get together with your friends, but let's try this board game that you got for Christmas 2 years ago. We might really like it. Those kinds of things are really important to do. And I'm hoping, 10 years down the road that some of these kids who are now stuck at home will have positive memories of the things they did, much like many of us have positive memories of having gone camping or on family vacations and the positive experiences we had then. All of our work lives are changing. Some people are out of work, which has its own challenges. Some people are working from home, which has its own challenges. Some of us, particularly in healthcare, are continuing to go to work, but everything in our work environment has changed. I know all of the primary care clinics in town, the places that you would typically go if you were sick or needed immunizations, have changed all of their practices. We certainly have at People's Clinic. We've done that so that we can provide care for sick people, but continue to provide the basic care for people who aren't sick with COVID-19 and to keep them safe. I think the most important thing for families to know is your providers are still here to serve you. We're doing that in all kinds of different ways. The best thing you can do is to call your provider's office if you have a need, if you have a question, if you are sick, so that we can help you access that care in the best possible and safest possible way for you. That may mean routing you to a different location if you have respiratory symptoms or fever in particular, so that we can keep our staff as healthy as possible and not unexpectedly be exposed. That may mean that we'll do a video conference or a phone visit with you. It may still mean that we need to bring you into the office, but all of the offices in town have completely changed their process for getting people through. So you're not going to sit in a waiting room. You're not going to be sitting close packed with other people. And so if you're worried about that, but you or your child really needs to physically be in your doctor's office, call and ask what the procedures are so that you can be reassured and you can understand what the protocol will be when you get there.
Good point. It really does speak to how important it is to stay connected and communicate with your care provider, because things will change. The access and the ability to communicate back and forth may change for a while, but nevertheless, there's still the priority of you as a patient with your care provider, and that's important for people to remember.
Right.
Let's go over to Matt. Dr. Matt Sojka, you're here with us from MercyOne. What would you like to share with the group today?
Well, I do echo Sheriff Thompson's concerns yesterday. We went from 15 cases a week ago Monday to 61 cases this Monday. That's a doubling time, about 3.5 days.
Yeah.
So that's a concern that we're seeing the virus spread in the community, and what we need to continue with the social distancing, wearing masks when you're around your grocery shopping, the other things out there. And then if you do have concerns, do reach out to your care provider. Video visits, I did one last week just because I was running out of medicine. So I took care of that and didn't have to go into the office, and it went very smoothly. And so connect with your provider. And if you need to be tested, take advantage of that connection with your provider, whichever organization they're with. And then we have our fever and upper respiratory clinic on Ridgeway Place there. And if you don't have a primary care, just call 272-CARE. But otherwise, take advantage of that. But your provider may send you there if you have symptoms to get tested or to be checked out, because we're trying to conserve PPE, the personal protective equipment that we have. Because if we do get a surge like Cedar Rapids has had in the last couple of weeks, we're going to be short, and we will need that equipment for all of our patients. So again, take care of yourselves, socially distance, but we are having a very much increase of our virtual visits, either phone or on the Skype, on the Zoom platform that we're using. And it works very well.
So are those virtual visits, are they prepared, or are they set up through the provider?
Yes.
Okay.
So I contacted my provider, and they weren't in that day, but one of the nurse practitioners was. And they said, go on to Zoom at this time. They connected with me, and I went through all my process.
Okay.
So very efficient and very user-friendly.
Very good. So once again, have that good communication with your primary care provider to be able to do that too. So
very much so.
Well, Pam, you've appeared. We can see you. Good morning. Thanks, Matt and Kim. Let's move on to Pam Delagardelle from UnityPoint. Alan, and I know you've got some additional information to talk to us about employers with returning workforce and that kind of thing, but any other updates you want to share ahead of time?
Sure. So thank you so very much for the opportunity. And I really want to do a shout out to our healthcare partners in this community. I think the collaboration and the cooperation has been dynamite. I think that, together we're really, moving mountains in terms of what we can do to support the community. And I also like to do a shout out for the many community partners that we have in terms of even employers who are helping round up personal protective equipment. I think it's safe for all of us to say that, we really train for and we plan for events like this, for disasters and pandemics, but I don't know if you ever think that it's really going to happen. So yesterday we identified that we were a full 6 weeks in with meeting in the morning. Now we're in full incident command situation. One of the areas that we continue to get a lot of questions about are from employers and, asking for guidance. And so I really would like to turn people to the science of what the Iowa Department of Public Health and the CDC put out, but we are also providing information about how to prevent the virus spread through practicing social distance, just like Dr. Sojka mentioned. And some of the things specifically for employers are, you may want to consider staggering your shifts to really reduce the number of employees at your clock or at breaks at any given time. Reviewing procedures really to identify ways to limit physical staff interaction. So the community partners have been really good about sewing for us personal face masks. We encourage people in the community to be, if you have to be out or if you are at work, really to wear those appropriate face masks. And we're asking employers to allow them to bring them in and wear them at work. Allow for frequent hand washing opportunities or providing hand sanitizer at all of the stations. So we get asked, how do we really identify people who are showing the signs? Well, we've implemented screening all employees as they come into work for fever, cough, sore throat, or shortness of breath, and in the middle of the shift and at the end of the shift as well. So there are employer screening flowcharts that can be found on the Department of Public Health website. But if an employee presents with a fever or respiratory symptoms, they should self-isolate and be off work until they are fever-free for at least 72 hours without the use of medications that reduce fever, and all other symptoms have improved, and at least 7 days have passed since their symptoms first developed. So there's information about isolation criteria as well, but we also are working with employers through the Iowa Department of Public Health recommendations to coordinate with their local healthcare provider to identify ways to test employees with COVID-19 symptoms. So, we have criteria that we have to use to test people. We are finding that some employers want to send people to us to get a negative test so they can return to work, but that is really not an appropriate use of that testing media. So we have established like a MercyOne, a designated respiratory clinic. Ours is over at United Medical Park. And it's a call first sort of thing, so we're ready for you. But employees that are experiencing symptoms of fever, cough, sore throat, shortness of breath, or other respiratory symptoms should call the clinic for additional guidance. If you have an employee that's been off work due to COVID-19 related symptoms, exposure, or travel, a return to work visit should be completed before the employee returns to the workplace. So we also are offering telephonic return to work visits to reduce exposure and ensure that employees can return safely to work. So that's, our advice on that front.
But I'd like to mention there are two documents that Pam referred to. Return to work COVID-19 is one of them. The other one, COVID-19 employer guidance. And they have been posted as of this morning on the Grow Cedar Valley resource page at growcedarvalley.com. So if you go to our homepage or our webpage and click on the coronavirus or the COVID-19 resource directory, it's at the very top of that homepage. It'll take you to this list of resources. And the ones at the very top are the most recent ones. So these two items would be included in that resource list to go ahead and access those two. I'd like to ask all of you about the mental aspects of what's going on for our community, our workforce, our families, coworkers, and everybody I know deals with this in different ways. One of our employers I visited with yesterday, a large employer, they took a survey of their employees, and it was a significant percentage of their employee workforce that echoed that they were having mental adjustments that were not comfortable at all with trying to get through this. And he was surprised to hear that. And I don't know that I was too much, but I think everybody is processing this in different ways. And I'd just like your thoughts on how we should be taking care of all of our folks. Any of you? Matt, how about you?
Well, one of the things you can do is, if you socially distance, exercise is still a good way to go. I walk my dogs in the morning bright and early. There's almost nobody out there, but I'm not near anyone. I can get a little bit of exercise in and take care of myself. So getting outdoors, biking, the trails here are fantastic. It's been a little cool the last couple of days, but trying to get out. Also, just again, as Dr. Neumann said, doing different things, board games, other things that are interactive and not just around our previous life. Things have changed significantly. So take care of yourselves in those ways. Rest and taking care of the stress is also important.
Dr.
Yeah.
Neumann?
You know, I would certainly echo everything that's already been said, but a few other things to think about. You know, a schedule is really helpful. So you may not think as an adult that you necessarily need a schedule, but if you are suddenly finding yourself with either a lot of time on your hands alone because you're not working, or if you're at home with your children, everybody will benefit from having a very set schedule. And, you know, you might get a little bit of pushback and you might actually even yourself feel like, oh, that's not needed. But the fact is that if you don't have a schedule, you're going to find at 11:30 in the morning that all you've done is watch the news over and over and over again, listening to the same thing. You know, one of the things that I heard actually through my church over the weekend that really struck me was a statement that everything in nature grows when it's fed. And so obviously we all know that if we eat too much, we are overfed and we grow. But if you feed your anxiety, it will grow. And again, I'm not taking credit for this. I'm just repeating it. If you feed your fear, it will grow. If you feed your self-confidence, if you feed your body by healthy eating, by regular activity, by the schedule, that will grow your confidence in what's going on. You know, feed your knowledge, not your fear. If you're looking for information, go to a reliable source, but limit how much you're doing. If you're not in healthcare, you don't need to be listening to everything that's said about COVID-19. You know, pick a little bit of time every day to keep yourself updated, but otherwise turn it off. It will do everybody more good. Everybody in your household will benefit from that. If you're really struggling, reach out. Again, most of the mental health providers in town are also providing telemedicine visits, including to new patients. If you are, most employers in town have an EAP contract, often with either UnityPoint or MercyOne. So reach out to your provider. Don't hesitate to ask for help. And I guess my last point is social distancing is not the same as social isolation. So call people you haven't talked to for a while, video chat with people who you can't get together with, reach out in positive ways and reconnect. Don't feel like you have to be sitting by yourself in a dark room.
Right. Oh, I love the grow part. I mean, we're Grow Cedar Valley, so
Right.
making good use of that word and that term is awesome. I mean, I really think that that really could satisfy a lot of curiosities about how should I be feeling and what should I be thinking and where should I be going. But I think you really shared some really wise advice. So thank you very much. How about you, Pam?
Well, I think Dr. Sojka and Dr. Neumann have both given very, very good advice, and I try to watch some of their work on TV, and are trying to follow that personally. But I will just say, from an employer standpoint, we have our employees are really experiencing something that we're calling pre-traumatic stress syndrome. So just trying to be ready for a surge of patients, not knowing what that's coming. And so we've had to put quite a number of things in place just for our own employees. We have a daily email that goes out. We're calling it the Daily Dose of Hope. We have counselors that are allowing people to dial into a Zoom meeting, a lot like this, and just be real and raw about their feelings and what they're struggling with as leaders, and then open, something different up to our frontline staff. We've embraced the use of our employee assistance providers, and so again, those people are available by call. But we also have prepared a mental health walk-in clinic if the surge in our ED prohibits us from being able to have our mental health patients kind of coexist with COVID positive patients. And so I think we're all best to follow the good advice of our physicians on this call. But in the absence of being able to get control of those feelings, I think there's good professional help available as well.
You brought up a good point. We, at our Grow Cedar Valley staff huddle yesterday morning, we talked about going through the stages of change, and we really we looked at it as as a real similarity to going through the grief process. I mean, there are just lots of stages and phases in getting through this, and recognizing each of those stages is to be respected and not to be shunned. And so we really had great internal conversation. And while we were doing that as an organization for ourselves, we knew that we needed to be able to help our businesses and our stakeholders and others in the community get through it too. So you've shared some really, really important information for us to be able to share with our investors and our stakeholders too. So I appreciate it. Is there anything each of you would like to say in conclusion? We've got just a couple more minutes, but if there's anything you wanted to touch on about how we as a community can help you in addition to making masks?
I would say one of the things we had talked about, and I was on a call this morning with Dr. Adams from UnityPoint, about really if the symptoms are milder, even if you're worried, contact your healthcare provider. Don't go to the emergency room if possible. There's a congregation of patients there. You're probably more likely to get ill in some ways because there are going to be the sick ones, the ones that are having respiratory distress that are going to need hospital care. So reach out to People's Clinic, to UnityPoint, to your MercyOne provider, and get directed to the right place. So you get tested if you need that, but trying to avoid the emergency room if at all possible.
Very good. Very good. Pam or Kim, anything else?
Well, we're deeply appreciative of the random acts of kindness that are coming the way of our healthcare providers. I think my best advice is really to continue to be kind with one another and patient right now, whether it's in your own home or for those of you that are working in your workplace. It's just utterly important right now. Things have changed and you know, it's hard to know if we'll ever go back to what we knew as normal. So that's my advice.
Very good point. Anything in parting, Kim, Dr. Neumann?
I think we can't say enough how important it is to reach out to your healthcare provider for advice. So even if you have COVID-19, most people, especially children, have mild symptoms and can simply stay home. Whether we test you or not will change absolutely nothing in the way we manage you. So if you come in and you have symptoms that could be COVID-19, they're very similar to flu symptoms, they're very similar to cold symptoms in some people, we're going to give you exactly the same advice. So don't get caught up on the why am I not getting tested sort of thing. We're testing people where it's going to make a difference. And typically that means people we know that we have to keep on top of very carefully because they are at high risk of deteriorating, of getting worse. You know, we'll talk to you about what to watch for. We're there for you if something does change. But just remember that right now we've been social distancing for 3 weeks? All of the other viruses in town have essentially disappeared because all viruses need people to transfer them from one person to another. Right. So the illnesses we're seeing are almost certainly almost all COVID-19 in terms of the respiratory symptoms. That doesn't mean that everyone who gets it will get sick and end up in the hospital. But the fewer people who get it, the percentage is low who need the hospital, but we won't overwhelm the hospital systems. So stick with the social distancing. It really, truly is making a difference. Don't worry too much that the numbers are going up. We knew that would happen because not everyone can social distance.
Right.
But please reach out for whatever health help you need or mental health to anybody who's offering.
Very good. Thank you. And thank you all, Dr. Matt Sojka from MercyOne, Dr. Kim Neumann from People's Clinic, and Pam Delagardelle from UnityPoint, Allen. We know you're all just exceptionally busy. So for you to be able to take a half hour out of your busy day to share with us and actually share with hundreds of people who are watching, we really, really appreciate it. So for those of you who were interested in seeing the governor's message on several of her Facebook page, Governor Kim Reynolds, our media partners, KWWL and Waterloo Courier, will be covering that too in just a few minutes. And I'd like to mention on Thursday, we'll have another Facebook Live, and we'll be welcoming Paul Kinghorn from University of Northern Iowa, the Center for Business Growth and Innovation. So for those of you who can join us, we'll see you Thursday at 10:30. And thanks again. Bye-bye.